Most people believe that diabetes can only be caught by a blood test. That is exactly what makes it so dangerous. Because right now, while you are waiting for that test, your body has already been screaming for months, and the warning signs are sitting right there on your hands, in plain sight, completely ignored. In the next few minutes, I am going to show you 9 signs your hands are showing you right now that almost nobody recognizes for what they truly are. Here is what most people never realize. Your hands are lined with tens of thousands of nerve endings, tiny blood vessels, and skin tissue that reacts almost immediately to what is happening deep inside your body. When blood sugar stays elevated for months or years, it begins silently attacking all three: the nerves, the vessels, and the skin, long before a single lab test would ever catch it. And the most alarming part? Every one of these signs looks ordinary. They look like aging. They look like tiredness. They look like nothing worth mentioning at a doctor's appointment. That is exactly why millions of people miss them every single year. My name is Dr. Richard Wells, and I have spent over 22 years working with adults over the age of 55 in internal medicine and metabolic health. In that time, I have examined tens of thousands of pairs of hands, and I can tell you with complete honesty, I have seen things on a patient's hands that told me more about their blood sugar history than any lab result ever could. I have also sat across from too many patients who looked at me and said, "Why didn't anyone tell me sooner?" That question has stayed with me for years. That is why I am here today, because you deserve to know what I look for before it is too late to make a difference. Everything I share here is grounded in real medical research, explained in a way you can actually use. Today, you will learn the 9 specific signs that appear on your hands when blood sugar has been elevated too long, what is actually happening inside your body when each sign appears, and one simple daily habit for each sign that can help slow or even reverse the damage. Let us get into it. Sign number 1 is something almost every patient has already experienced, and every single one of them has explained it away: tingling or numbness in the fingers. Many people do not see this as dangerous. They think their hand simply fell asleep, or that they slept on it wrong, or that they have been typing too much, and occasionally, that is exactly right. But I always ask one question: is this happening regularly without a clear reason? Because if the answer is yes, we need to talk about what is actually going on. When tingling or numbness appears regularly in the fingers, particularly the ring finger and pinky, without a clear mechanical cause, what you may actually be experiencing is the earliest stage of peripheral neuropathy. Here is what is happening inside your body. Excess glucose in your bloodstream activates a biochemical pathway called the polyol pathway, which floods your nerve cells with a sugar alcohol called sorbitol. Sorbitol accumulates faster than it can be cleared, and it slowly disrupts the electrical insulation around your nerve fibers, the myelin sheath. Think of it like corrosion eating through the coating on a copper wire. The wire still carries a signal for a while, but the signal becomes unreliable. You feel it as tingling. You feel it as numbness. A study published in the journal Diabetes Care confirmed that finger tingling is one of the earliest and most consistent predictors of undiagnosed peripheral neuropathy in pre-diabetic adults. I once treated a 64-year-old retired school principal who told me her fingers had been falling asleep at the keyboard for nearly 3 years. She had stopped typing for long periods, switched keyboards, even seen a chiropractor. Her fasting glucose that afternoon came back at 198. She had been diabetic for at least 2 years without knowing it. Stop right now and honestly think, how often in the past month did your fingers feel numb or tingly without a clear reason? Comment that number below. The fix is not complicated. Start with a 20-minute walk after your largest meal of the day. Post-meal movement is one of the most powerful natural tools for lowering blood glucose spikes and protecting nerve tissue. And begin cutting added sugar from your diet starting today, not next week, today. Now, sign number 2 surprises almost everyone because it has nothing to do with pain or sensation. It shows up on your skin in plain sight and still nobody connects it to blood sugar. Sign number 2, and this one my patients almost never expect. Many people do not see it as dangerous at all. They assume it is sun damage, genetics, or simply aging skin. But there is a specific pattern of skin darkening. Velvety, slightly thickened patches that appear at the knuckles, in the folds between the fingers, or at the wrist crease, that has a name, and that name matters. It is called acanthosis nigricans, and it is directly caused by high insulin levels driving the skin cells into overdrive. When your body becomes resistant to insulin, your pancreas produces more and more of it trying to compensate. That excess insulin binds to receptors in the skin called IGF-1 receptors and triggers abnormal skin cell growth. The result is those dark, soft, velvety patches. They are not a cosmetic issue, they are a metabolic alarm. Think of it like a factory receiving too many orders and running its machines past capacity. The output becomes distorted, thickened, and dark. A study published in the Journal of the American Academy of Dermatology found that acanthosis nigricans was present in over 74% of individuals with confirmed insulin resistance, and it appeared on average 14 months before a formal diabetes diagnosis. I once treated a 71-year-old retired nurse who had noticed darker patches at her knuckles for over a year. She assumed it was poor circulation from age. Her HbA1c came back at 7.4 that morning. She was already diabetic. Look at your knuckles right now. Have they looked a little different for longer than you care to admit? Be honest in the comments below. The fix: reduce refined carbohydrates at breakfast specifically. A high-carb breakfast triggers the largest insulin spike of your entire day. Switching to eggs, vegetables, and healthy fats in the morning can meaningfully lower chronic insulin levels within weeks. Sign number 3 is even more personal, and most men especially push through it for years without ever mentioning it to their doctor. Sign number 3, and this one surprises people the most, because it looks like something completely unrelated to blood sugar. Many people do not see it as dangerous. They think it is just age. They joke about jar lids getting harder to open. But grip strength is not merely a measure of muscle. Research now treats it as a direct window into metabolic health. Chronic high blood sugar damages the microvascular supply to skeletal muscle, the tiny blood vessels that deliver oxygen and nutrients to your muscle fibers. When the muscle in your hands and forearms is starved of oxygen, it begins to atrophy. Glycation, the process by which excess glucose binds to structural proteins in muscle tissue, stiffens the fibers and reduces their contractile efficiency. Think of your muscle fibers like elastic bands. Glycation is like soaking those bands in a sugar solution and letting them dry. They still stretch, but they lose their snap entirely. A landmark study in the journal Diabetologia found that reduced grip strength was a statistically significant predictor of type 2 diabetes development in adults over 50, independent of body weight or activity level. I once treated a 68-year-old former carpenter, a man who had worked with his hands his entire life, who came to me because he could no longer reliably hold a wrench. He assumed it was arthritis. His fasting glucose that day was 2 on 31. How tight is your grip today compared to 5 years ago? Honestly, write it in the comments. The fix: begin a simple daily hand strengthening routine. Squeeze a soft rubber ball for 2 minutes per hand, twice a day. Grip strength training directly stimulates glucose uptake into muscle tissue, one of the body's most efficient natural blood sugar regulation mechanisms. Sign number 4 is something you feel at night, and most people have lived with it so long they have stopped mentioning it to anyone at all. Sign number 4, and this is the one that hits people when everything else is quiet. Many people do not see it as dangerous. They take ibuprofen, they sleep with their hands elevated, they wear wrist braces and assume it is carpal tunnel, but nighttime burning in the hands, that deep, diffuse aching that arrives when the house is silent and there is nothing left to distract from it, is frequently a sign that the nerves in your hands are under sustained attack from elevated blood glucose. The mechanism is this: damaged myelin sheaths cause nerves to misfire, sending false pain signals to the brain with no real physical cause behind them. At night, with no competing sensory input, those signals dominate your awareness completely. Think of it like a car alarm damaged in a fender bender that starts screaming at 3 in the morning for no reason. Nobody is breaking into the car. The alarm is simply broken. That is exactly what a damaged nerve does. It sends alarm signals when nothing is actually wrong. And taking ibuprofen does not fix a damaged nerve. What it does is mask a signal your body is desperately trying to send you. Research in the New England Journal of Medicine confirmed that painful peripheral neuropathy affects approximately 1 in 4 people with diabetes and is routinely mistaken for arthritis, carpal tunnel syndrome, or age-related joint degeneration. How many nights this month did your hands wake you up or keep you from falling asleep? That number matters. Write it below. The fix is not complicated. Every night before bed, perform 2 minutes of slow, deliberate hand stretching. Open your fingers fully, hold for 5 seconds, close into a fist, hold for 5. Then add magnesium-rich foods to your evening meal: leafy greens, pumpkin seeds, almonds. Magnesium plays a direct role in nerve signal regulation and glucose metabolism. Sign number 5 affects how your hands look every single day. And you may have been blaming the completely wrong cause for years. I want to pause here for just a moment. We have been through 4 signs so far, and I want to ask you something directly. Have you noticed any of these in yourself or in someone you love? A spouse, a parent, a sibling? If the answer is yes, even one sign, go to the comment section right now and type the word yes. Just yes in capital letters. That is all I need. I read every single comment on this channel. Everyone. If you have a question, ask it. If you are concerned, tell me. That is why I created this channel, not to talk at you, but to talk with you. And if you are finding this useful, hit the like button right now. It takes 1 second and it tells YouTube to show this to more people who need it. All right, let us keep going. Sign number 5, and this one is hiding in plain sight on the surface of your skin every single day. Many people do not see it as dangerous. They blame winter, they blame hand washing, they buy more lotion. But when the skin on your hands cracks persistently and does not respond to moisturizer the way it used to, the cause may not be external at all. Autonomic neuropathy, nerve damage to the system that controls automatic bodily functions, disrupts the sweat glands in the skin. Your hands lose their ability to regulate moisture from the inside out. No lotion can fix a broken internal plumbing system, and those cracks in the skin are not just uncomfortable, they are open entry points for bacteria. In a person with compromised circulation and elevated blood sugar, a minor skin infection on the hand can escalate rapidly and become very serious very quickly. The American Podiatric Medical Association identifies chronic treatment-resistant skin cracking as a significant clinical marker of autonomic neuropathy, a condition directly linked to long-term elevated blood sugar levels. Moisturize both hands every night before bed using pure coconut oil or a urea-based cream. But more importantly, increase your daily water intake to at least 8 full glasses. Your skin's internal hydration depends on it just as much as external application. Sign number 6 is something most people notice but never take seriously, because it looks completely harmless on the surface. Sign number 6, and once I explain this one, you will never look at your wrists the same way again. Many people do not see this as dangerous. Skin tags are incredibly common. Dermatologists remove them every day without a second thought. But clusters of skin tags appearing specifically at the wrists or the base of the fingers are now recognized in metabolic medicine as a soft but meaningful clinical marker for insulin resistance. Excess insulin in the bloodstream stimulates IGF-1 receptors in the skin, the same receptors involved in acanthosis nigricans, triggering localized overgrowth of skin cells. Those small, soft, fleshy tags are the result of that overgrowth. Think of it like a printer receiving a corrupted signal and printing the same line over and over. Excess insulin tells the skin cells to keep multiplying long after they should have stopped. A study published in the Journal of the European Academy of Dermatology confirmed a statistically significant correlation between multiple skin tags and insulin resistance, independent of body weight. Have you developed any new skin tags in the past year, particularly around your wrists or fingers? If yes, note it in the comments. The fix: reduce your intake of ultra-processed foods. These products are engineered to spike insulin repeatedly throughout the day, creating exactly the chronic insulin excess that drives this kind of abnormal skin growth. Read every label. If the ingredient list is longer than 5 items you cannot pronounce, put it back. Sign number 7 involves something you look at every single day, and it is quietly showing you something important about what is happening inside your blood vessels right now. Sign number 7 is the one I see most often dismissed, and by the time patients realize what it means, it has been going on for years. Many people do not see slow nail growth or thickened nails as dangerous. They blame age, nail fungus, or nutritional deficiency. Sometimes that is correct. But when nails begin growing significantly more slowly than they used to, become thickened or discolored at the base, or develop small horizontal ridges running across the surface, these are signs that the nail matrix, which depends entirely on steady blood supply, is being quietly undernourished. High blood sugar damages the capillaries supplying the nail bed, reducing oxygen and nutrient delivery to the follicle. The nail itself is not diseased, it is starving. Think of it like a plant that suddenly stops growing, not because something attacked it, but because the irrigation pipe feeding its roots has slowly been narrowing for years without anyone noticing. Research published in the Journal of Investigative Dermatology found that nail bed capillary changes are detectable in patients with long-standing elevated blood sugar, often appearing before formal diagnosis is ever made. The fix: add zinc-rich foods to your diet every day. Pumpkin seeds, chickpeas, cashews. Zinc is essential for nail matrix cell reproduction and directly supports the microvascular integrity that keeps the nail bed alive and properly nourished. Sign number 8 is so subtle that most people walk past it every single day without ever noticing. But once you know what to look for, you will never unsee it. Sign number 8, and this is the one almost nobody ever talks about. I have almost never seen it covered in a patient brochure. Most people walk right past it every single morning. But during a hand exam, when I look at the back of the hands and the fingers, sometimes there is a visible absence of the fine hair that used to grow there. The patient looks down and says, I never noticed that, and that is exactly the problem. Hair follicles are among the most metabolically demanding structures in the entire human body. They require a continuous, reliable supply of oxygenated blood. When the small vessels feeding those follicles narrow from years of glycation and chronic inflammation, the follicles go dormant, quietly, without fanfare. The hair simply stops appearing. Think of hair follicles like small plants in a garden. When the irrigation pipe narrows or blocks, the plants do not die immediately. They just gradually stop growing. That absence of growth is your body sending a visible message about your blood vessel health, a message you can see every time you look at your own hands. Research published in the journal Diabetes, Obesity, and Metabolism found that hair loss on the dorsal hand surface correlates significantly with peripheral arterial disease in patients with type 2 diabetes. Look at the back of your hands right now. Is the hair thinner than it was 5 years ago? Is there noticeably less of it than on your forearms? If the answer is yes, please see your doctor this week and request a fasting glucose test, not this month, this week. The fix: 30 minutes of brisk walking daily is the single most effective non-pharmaceutical intervention for improving peripheral blood flow and slowing arterial narrowing. Start with 10 minutes today if 30 feels like too much. The important thing is to start. Sign number 9 is the most overlooked of all, and it is one your hands are already showing you every single day if only you knew what you were seeing. Sign number 9, and this is the one that stops people cold when I explain it, because they had always assumed it meant something completely different. Many people do not see occasional hand tremors or increased clumsiness as dangerous. They attribute it to stress, too much caffeine, or simply getting older. But recurring hand tremors in adults over 60, particularly ones that come and go throughout the day, can be directly connected to blood sugar instability. When blood sugar drops sharply after a high carbohydrate meal, the body releases adrenaline as a compensatory emergency mechanism. That adrenaline surge causes the hands to tremble. It also reduces precision in fine motor control. Additionally, chronic nerve damage affects proprioception, your body's internal sense of where your hands are in space, leading to subtle clumsiness that most people write off as simple tiredness. Think of it like trying to tune a radio with a damaged dial. The signal exists, the mechanism just cannot find it reliably anymore. How many times this month did you notice your hands feeling unsteady without a clear reason? Comment honestly below. The fix: never skip meals and always pair carbohydrates with protein and fat. Eating carbohydrates alone produces sharp glucose spikes followed by rapid crashes, the exact pattern that triggers adrenaline release and hand tremors. A small handful of almonds alongside any carbohydrate-heavy snack dramatically flattens that curve and protects your nervous system from those dangerous drops. We have covered a lot today. 9 signs, 9 chances to catch something before it catches you. Tingling or numbness in the fingers, an early warning from your nerves. Darkening skin at the knuckles, your insulin levels speaking through your skin. Reduced grip strength, your muscles losing their metabolic efficiency. Nighttime burning pain, damaged nerves misfiring in the quiet hours. Dry cracking skin, autonomic nerve damage cutting off your body's internal moisture system. Skin tags at the wrists, insulin overstimulating your skin cells. Slow or thickened nails, your nail beds being starved of blood. Hair loss on the back of the hands, your small vessels failing their most demanding passengers. And trembling hands, blood sugar instability showing itself in real time. And I want to be honest with you about something. If you have been living with one or more of these signs for months or even years, it is not too late. The human body has a capacity for recovery that genuinely humbles me after all my years in medicine. Nerves can partially heal. Blood vessels can regain flexibility. Skin can restore itself. But only if you give it the right information and the right conditions to do so. You have that information now, and I want you to do one thing with it. Just one thing. Tonight, before you go to bed, hold out your hands and look at them. Really look. Check the skin. Feel for numbness. Look at the knuckles. Look at the nails. That is all I am asking. 30 seconds. And if you see or feel anything on this list, please call your doctor tomorrow. Not next week, tomorrow. Think about being able to button your shirt without a second thought, to hold a grandchild's hand and feel every single detail of it, to reach for a glass of water and trust, completely trust, that your hands will be steady and sure. That is what this is really about. Not just a blood sugar number on a piece of paper. Your independence, your confidence, your quality of life. You worked hard for the life you have. Do not let something as manageable as blood sugar take any of it from you just because nobody told you what to look for. Now you know. I want to hear from you. When you looked at your hands during this video, what did you notice that you had never paid attention to before? Leave your answer in the comments. I read every single one, and I mean that. Subscribe to this channel. Every week I share straightforward, research-backed health information for adults over 55. The conversations your doctor does not always have time to have with you. If this helped you, hit the like button right now so more people can find this before it is too late. Write the word hands in the comments below. Your commitment to your own health may inspire someone else watching right now to take the same step, and share this video with someone you care about, a spouse, a sibling, a friend. You may never know whose life you quietly protect by doing that one simple thing. This is Dr. Richard Wells. Take care of your hands. They have been working for you every single day of your life, and now it is time to work for them.